Hi guys, it's Dr. Ryan Rebowe here with the Park Clinic for Cosmetic and Reconstructive Surgery, and I wanted to talk a little bit today about something that's not often talked about, I find, on social media and other areas and avenues, which is treatment of gynecomastia or male breast enlargement. It's important to note that this issue is actually much more widespread and much more common than most people think. I think a lot of gentlemen are really embarrassed to come in and talk to either Dr. Park or I about this, but it's important to note that it actually is a very common issue and we see a lot of people with it. So the first question is always, why did this happen or why did I get this? And there are two different types of gynecomastia, and the first one is true gynecomastia, where men do have breast tissue and it can get slightly enlarged either at puberty when you're very young or when you're older, like in your 40s, 50s, maybe even 60s. For whatever reason, some men's tissue is more responsive to certain hormones, which will cause the breast tissue to enlarge and give you sort of this larger sort of inflamed look to your breast, which can be very concerning for a lot of very young men and a lot of older men as well. A second type is called pseudogynecomastia, where you actually just have an enlargement of the fatty tissue. And this is very common in men who tend to gain and lose weight very easily, or even men who have undergone massive weight loss either on their own or with surgery. So it's important to note that there are lots of different ways to treat this. There's no one standard way for everybody. I will tell you that in younger men, often in their teens or early 20s, we'll start with things like liposuction because they're less invasive and they leave you with less of a scar while greatly improving the contour. So we'll typically do liposuction around the area of the breast. And we may also combine this with some sort of what we call a breast bud excision, where we will make a small incision underneath the nipple and remove that breast tissue that's directly underneath so that we can give you a better contour and prevent it from happening again. If you've had massive weight loss or you're a little bit older and the skin quality is not as good, you may actually require a skin excisional procedure. Now, I think a lot of men think about this sort of like a breast lift for women, but we actually do a little bit different technique in men to give you that more masculine appearance of the chest that men, of course, desire. So we can either make a small incision, smaller incision rather, underneath the breast, or a straight line incision underneath the breast that'll give you the sort of more masculine appearing chest that you want while preventing any type of scarring or preventing any type of excess scarring or look like a female chest that is a concern of a lot of men. So again, I think the important things to note are that men who have this problem have a lot of options, and it's also much more common than you might think. And so don't hesitate to contact either Dr. Park or I by email or schedule a consultation to come in and see us because this is something that we're familiar with and that we feel like we can help you out with.